schools and marketing our programs, we reached 650 plus. And as you can see on this map, we're very proud to say we're really all over the city, north side to south side, and we're really serving students across the city. So just a little bit about the Discovering Healthcare Career Programs. This program traditionally is in person. It was developed back in 2001, so it's been longstanding for 19 years now. It's a 6-week summer internship program for Hispanic, Latinx, and African American Black high school students. With this program, we hope that these students, as mentioned in our mission, gain leadership development, real-world healthcare industry exposure, training workshops, networking opportunities, and the potential for future employment. And the reason why this program was created, I'd like to really give a shout out to our manager of the programs, Maria Rivera. The aim is to diversify our workforce to make sure that we have nurses and people in these positions that mirror our diverse patient population. So the creation of these programs is, to fulfill that mission of diversifying the workforce at Lurie. At the end of this program, students receive a scholarship for participating in the program, successful participation, attendance, and just being attentive in the program. Students are compensated for their time. So during this time, Forbes stated in a study that was published, there was a decline in internships due to the pandemic by 92% since March 9th. And according to reporting in the Survey Money, 42% of employers actually continued their program and transitioned to an online format. So we're very proud to be part of that 1 out of 2 internship sites that were able to continue despite the pandemic. And on the right, you see some images of our students that they submitted to us as they are now online, learning. Some of them are college students, some of them are in their last year of high school. So we can definitely see a need for educational opportunities via internships. So a little bit about the 2020 virtual program, kind of what happened. So the first thing was making sure students could get their materials for the program. So with our staff, we divided up into different locations. We all went to different parts of the city to meet students through email and contacting them where they can go and pick up their location. So we made sure it was like at a library, at a very public area. So on the top right, that's myself just handing out some packages to our students. And then the other staff went to the different locations to make sure they had the materials that they needed to be successful in the program. We had a lot of Lurie healthcare professionals and external partners present to students about various healthcare career topics. So in the middle picture, you can see Dr. Maria Ferreira talking to our students about immigrant health, which is very important. And on Fridays, a really amazing component that the students enjoyed was Clinical Fridays. So in their material package, they received a suturing kit. And with that, our clinical instructor, Sharon, was the one who set up this lesson and trained all our other student assistants to help the students walk them through how to suture with their suturing pad. Something that was really new and so very relevant was learning about research with the focus on public health. And with this, we put students into groups, gave them a research topic, they developed the research question, and then they were able to present that data and information to their peers. So we can see a virtual summer program at a glance. Something that is important to note is that we had the Discovering Healthcare Career Program and the One Summer Chicago program, 2 programs that we would run separately. We combined them to be just a virtual learning opportunity for students. And given those 2 programs combined, these were our stats for the summer. So we had 45 schools that we partnered with. We had over 236 applicants for this program. We interviewed virtually each and every one of the ones who followed through, 203 student interviews. Of those, we selected 93, and all of them came from 40 different zip codes throughout the city. So this is just a snippet of, a very busy week. No day was alike in the 6 weeks of our program. We tell students to log in at 8:45 to troubleshoot any tech issues, but our program ran from 9 a.m. to 2 p.m. in this particular day, it was Tuesday in July, from 9 to 10, they had a speaker from the transport team. From 10 to 11, they had 2 doctors from the emergency department. And with our guest speakers, we give them a general itinerary of items we suggest that for them to cover, but we really give them leeway to present their career in whatever manner they'd like. A lot of them just talk about their career pathway, education, what they enjoy about their career. From 10 to 11, for this particular session, the ED docs took the students on a virtual tour of the emergency department and went through some x-rays and just simulations in the ED for the students, which they really enjoyed. From 11 to 11:30, students were presented with the Chicago Youth Service Corps project that they worked on. They have a 30-minute lunch break for them to just stretch, go eat something, and then join us back from 12 to 1. We had another speaker session, hospital-based medicine. And from 1 to 2, we ended off with another doctor in gastroenterology. So they really have a mix of careers and just different items that are covered each day. And then this is a typical week. It looks very busy. So this was a week in July, and the day that I pulled from was Tuesday, July 14th, just more in detail. But you can see students have a range of sessions. On Monday, they had the CCR team, which is the Center for Childhood Resiliency at Lurie Children's. We felt mental health was very important to cover with students. So they had this ongoing series to really just talk about mental health, checking in with the students and giving them best practices to cope with, really what was going on during that time and is still going on. They also have sessions with the adolescent medicine team going over Gender 101. They have mentors who are college students from Chicago Czech to help them navigate college applications, how to apply for scholarships. And then as mentioned, Friday are the days that is all clinical, very hands-on. And each week they go through a different body system. And this week they were going through the digestive system. So no week is alike, no day is alike, and students definitely had a variety in their schedule. Here is an extensive list of the participating departments. I'll name a few, but again, students were able to just see the plethora of healthcare careers. We have child and adolescent psychiatry, emergency medicine, nursing education and research, healthy communities, social work, speech and audiology, just to name a few from our pretty extensive list. And a part of the clinical component, we really made sure our students walked away also with some certifications and training. They did an online CPR certification course. They did an LGBTQ 101 training, emotional health and COVID webinar. And they also did virtual interactive learning. So they did some virtual dissections, suturing, again, which was a very popular one with the students. They did reproductive health education, trauma and stress coping workshops. And again, we really just wanted to highlight just the amount of fun students had with the program. This one, students were proudly showing their suture. They did an uninterrupted suture that Sharon, who has these awesome skills, was able to put together instructional videos and teach our summer assistants how to moderate these groups and teach the students so that they could all be successful in getting their sutures correct. And these are some samples just of some of the public health research presentations the students did. On the top left, we see mental health in Englewood. Students really looked at the environmental factors that impacted Englewood communities and mental health. On this one, students researched on the east side of Chicago, the impact of air pollution. And on this one, we see students got creative in terms of breast cancer in Humboldt Park and putting together a flyer for people to seek more information and included a QR code of where they could go to get more resources. So students got very creative and we gave them that creative freedom to really present their findings to their peers and for them to learn from each other. And then just some general information about our program participants. We had a total of 100. We had 93 students and 7 of them were our summer assistants that we included in the data. So for race ethnicity, we can see 40%, 46% were Hispanic, 41% were Black African American, 6% self-identified as mixed, 3% were Caucasian, and 1% identified as Native American. In terms of the gender breakdown tends to be more heavily female dominated, 81%, and the other 19% were males. So a little bit into the program evaluation, so the impact measurement strategies. Students were given pre and post assessments to evaluate as we were going how effective the program was. And again, we measured in the 5 areas that we aim to implement in our programs. So their overall experience, healthcare career knowledge, career pathways, professional development, health education, and their clinical skills techniques. This was done through weekly reflections. So they were very in-depth. Students were always reminded to complete their weekly reflections. And it allowed us to see, what do they like, what do they not like, and what we can change, as well as if they're having any tech issues or any barriers that we need to be aware of. So in this slide, we can see a sample of the evaluation survey. So this question in particular is their knowledge of health careers and their intent to pursue a career in the field. Question 5, it asks them, what are their 2 top career choices? And they can write them in here. And also to compare, has that changed? What's different? And also, why are they interested in healthcare careers? And it gives them options to check in, as well as to be specific if one of their interest in healthcare careers isn't on there. And then the evaluation survey, they use a Likert scale. So with the Likert scale, you have in the drop-down box options, you have disagree, strongly disagree, disagree, neither agree or disagree, agree or strongly agree. And then this one, we were measuring professional development. So the first one being, I understand what needs to be included in a professional resume. And we want to see how that changed with the pre and post evaluations. So in this one, using the Likert scale of participants who responded to strongly agree, one of the questions in the pre and post evaluations was, I am knowledgeable on the types of careers in a hospital. So in the pre-evaluation, 24% of participants said that they were. We can see a jump in the post-evaluation after, having done those sessions on types of careers in the hospital. And then the second, one of the second questions that we pulled using the Likert scale is, I'm able to provide examples of health disparities that face groups of people across communities in Chicago. We can see in the pre-assessment, 14% were knowledgeable of this. And by the time they had the post-assessment, that number jumped to 50%. So in terms of the weekly feedback response, students were able to type in exactly what they liked and didn't like. This question in particular asked, what did you like about our guest speakers overall? Students said their jobs made a huge impact on Chicago communities. They enjoyed how interactive the sessions were. The speakers were very kind, inspiring, and outgoing. And what did you not like about speakers? Again, this helped us really to hone in on how can we make these sessions perhaps more interactive, more Q&A. Time constraints and also some tech difficulties were reported in a lot of the what did you not like type of questions. So some of the items that we learned was that, probably an obvious one now, but not all students have access to laptops or reliable Wi-Fi. So ensuring that we have a call-in option when their Wi-Fi isn't working, so at least they can listen to the content that is being, said by the guest speakers, by our presenters. Also reminding students to have the Zoom app on their phone in case their laptop isn't working, so they can join us through their cell phone. We also made great use of the Remind app. It's a safe way to text our students individually and in a group, and it's monitored. So that way we can communicate with them in case they miss an email. We also make sure to have recordings of the session so that students can view those at a later time if they did have to miss, if they had an emergency, whether it be familial or medical emergency, and also understanding what their needs were and how we can coordinate with their schools to ensure that they get a laptop loaned for the summer, and also to be able to do our programs or other things that they need to do on a laptop. And another thing that I reiterate is, how do we continue to make these sessions interactive and make sure that we're providing students with the materials that they need to be successful in our programs? So the next steps is we want to continue to offer a program virtually. Some of our programs now that run through the fall have been adjusted to an online platform. So we're currently doing that for some of our upcoming ones. So how do we continue to do that and navigate the tech issues? And also our cohort that happened in the summer 2020, how do we continue to re-engage them as they're now alumni? We have 2 programs called Learn to Lead, and this one we focus more so on educational sessions. In Advance Your Future, we do a lot of job training and healthcare certificates that we offer students for them to continue to grow professionally and career-wise. And again, the main objective, if they want to work at Lurie's, how do we offer them employment opportunities to come back and serve our patients here? And before I end off, I'd really love to leave you all with the video one of our summer assistants put together. The vision was from our program manager, Maria, with the song Together that was very popular, and students all participated and sent in their pictures. And I think it really captures what our summer was like, the challenges that we had, but again, we all came out through it together stronger. So I'm gonna stop sharing and reshare my video so you guys can see that. Alrighty, let me know if you can't hear the audio or if you're having any issues so I can fix that. So I'll just play it.
This is for the busted hearts. This is for the question marks. This is for the outcast soul, lost control, no one knows. Sing it for the can't go back. Sing it for the broken past. Sing it for the just found out. Life is now upside down. If you're looking for hope tonight, raise your hand. If you feel alone and don't understand, if you're fighting the fight of your life, then stand. We're gonna make it through this hand in hand. And if we fall, we will fall together. This is for the second chance. This is for the new romance. Sing it for the left in vain. Overcame. It's not too late. If you're looking for hope tonight, raise your hand. If you feel alone and don't understand, if you're fighting the fight of your life, then stand. We're gonna make it through this hand in hand. And if we fall, we will fall together. Together. Oh, and when we rise, we will rise together. Together. Listen, if you're looking for hope tonight, you're all alone. If you're feeling alone tonight, and you feel if you're in the fight of your life, I can promise we're gonna make it happen. I will be by your side. By your side. In the air tonight. Can you feel it? I will be see the light. Whenever and wherever, just as long as we're together. Say we fall, we will fall together. I got you, my brother. I see you, my sister. We rise, we will rise together.
Okay, thank you, Yazmin.
Yeah, and that concludes the presentation. Sorry if I went a little overboard, and just want to say thank you for being here and listening to the presentation, and like to give a shout out
Get a $200
to,
bonus.
oh my gosh,
Open a BMO Harris Smart Advantage account.
to Maria Rivera, or sorry, the audio, is the audio still there? Oops. Sorry about that. to Maria for being here, Selena and Sharon. And if you have any questions, I can drop our email if you'd like to reach out any additional questions that you have for me or the team. Thank you.
Excellent. Thank you very much. Okay, we'll have questions at the end. Our next presenter is Wesley Epplin, and the title of his paper is Equitable Internships, a Public Health Workforce Imperative.
Thank you very much. And thank you, Yazmin, for your great presentation. I learned a lot, and I look forward to our Q&A and being in touch with you about your program, because I see some connections and other differences that I want to highlight at the start in terms of what I'm talking about with internships is a much smaller program. Health and medicine has historically had at any one time probably 3 to 5 interns maximum working with us. And we were founded in 1981, so we've had probably hundreds of interns come through our doors during that time. And really excited to talk about the changes that we've made over the last few years. So I'm again, Wesley Epplin. I serve as the Director of Health Equity at Health and Medicine Policy Research Group. Here to talk about equitable internships as a public health workforce imperative, something that we have to get right and have to figure out as a field. All right, so Health and Medicine, again, was founded in 1981 by Dr. Quentin Young. Our mission is to improve health equity. Sorry, our mission is to improve the health of all people by advancing health equity. And health equity is a process of assurance of the conditions for optimal health for all people. Health equity requires at least 3 things: valuing all individuals and populations equally, recognizing and rectifying historical injustices, and providing resources according to need. Health inequities will be eliminated when this process of health equity is implemented and achieved. And I really appreciate this definition specifically because I appreciate this because it talks about health equity as a process and something that we can engage in on a day-to-day basis, and not something that is, it's not just an outcome that's a long way away. It's something that we can engage with every day. And so that's what I appreciate about it. It was, this definition is from Kamara Phyllis Jones, who's a recent past president of the American Public Health Association. And as we talk about this, I really want to talk about health inequities as well, and differentiate health inequities from health disparities. Health disparity is a difference in health status or outcomes across different population groups. And it really doesn't have a lot of judgment about the relative fairness of that difference. Whereas a health inequity is a systemic difference in health status or outcomes across different population groups that is seen as unfair, unjust, and remediable. And what do we mean by unfair and unjust? That there's a human rights and moral social justice imperative to do something about it. And that by remediable, we mean that steps can be taken to counter and redress, to remedy the situation. And so that's really important. I really appreciated what Yazmin said about the who is represented in the health workforce, and that's really the focus of our internship program, is to change who is at the table. We're a policy organization, and so when we talk about health inequities, we have to talk about who's in the room when we're talking about policy and who's most impacted by health inequities. In Chicago, as in many cities, it's our Black and Brown communities and people living in poverty who the patterns of health inequity mimic are a result of the root causes of racism and classism and sexism, and we have to talk about that, right? And those systems also impact people's ability to pursue education and to pursue a health career and to get an internship. And so that's really, we've set up our program with these changes to try and do our part to counter those things with an eye toward the field getting this right, not just stopping with our program, which, as I said, is 3 to 5 people at a time is not a large program. We want to change ourselves and what we're doing such that we're able to change the field as well. So I'm not going to go through this list of questions, but I think I raised these questions to say that I think we've been on different sides of this. I've worked as an unpaid intern. I've worked with unpaid interns, people who have reported to me, who I've precepted, who've collaborated with me. I've also, worked with paid interns and have worked to change that because I recognized that that was not okay at the organization where I work, because the work that our interns were doing, these are graduate students who were really contributing to our policy analysis in really real ways, 15 to 20 hours a week for often 3 to 4 months, sometimes longer. And I know that that's a common thing in our society and in our field, but we recognize and we're troubled by that and have decided to change it at Health and Medicine, as I know other organizations are doing. So what's the problem? Unpaid internships and the need to pay people. Not everybody can afford to work. And when I want to differentiate here from what Yazmin was talking about, because I'm not sure if the interns that she was discussing were being paid or not, but I think here we're talking about 15 to 20 hours a week is a lot of time, right? That's basically the amount of time of a part-time job. And we're talking about people who are in graduate school and often trying to pay for school and other necessities. And we didn't want that to be both a barrier, which we had, at least, people had told us that was a barrier to them being able to intern with us, but also that linked to our passive recruitment that we had before, which was basically an open inquiry form on our site. So if somebody was interested in interning with us, they could fill out that form. The problem is that, as I discussed before, the systems of oppression mean that, and of exclusion mean that not everybody's going to hear about that internship opportunity or know to go find it on our site. And so that really mirrors our the segregation of our society, how the social networks of staff or board members are going to reach some groups more than they're going to reach other groups. And so that's going to lead to us having, because of passive recruitment, we're basically not intervening on those inequities that I just talked about. We also had several doors of entry. So there's that application, but somebody could also shoot an email over to me or any other staff member or a board member or something like that. So that, again, is kind of mirroring that those social networks that are set up because of the deep injustices of our society. Those are segregated and unfair relationships, and they are exclusive, right? And we want to intervene on that. Internships should be a way for people into the field, such that our fields do reflect the communities that they serve. And then I just want to raise, interns do pay to work often. Universities charge students for the credit that they get for working an internship often, for the benefit of getting credit for a practicum, for example. And some people would argue that that's a fair setup, that they're getting experience and they're getting the learning opportunity, and the university has set up those relationships, and that there might be some grains of truth there. But I think for these other reasons I'm raising, that it's really not a fair setup. And people in graduate school who it's one of the requirements often, to do that practicum, aren't necessarily in a position to argue about it. They'll pay up and move on. So what's the problem? Again, I don't think this is aligned with our values of equity and justice, the unpaid model, the passive recruitment. Again, it's not accessible to a lot of people. It mirrors and exacerbates the inequities in our society. This can ripple across somebody's entire career because it's at near the start of the career and during education. It certainly ripples across our sector and our economy and our society in terms of, again, who's at the table and who's not. And it does exclude people, and that's not acceptable. And so that's something we have to work on. That's something we have to get right. And then I just want to say we're also missing out on the skills, ideas, perspectives, and contributions of people who are excluded. So we all lose out from inequity, even while it obviously disproportionately impacts the people who are most impacted by that inequity, but we as a society are collectively worse off for it, and we can't achieve that process of health equity, which again has those three requirements. Valuing all individuals and populations equally means bringing everybody, making the tables equitable, and we can't do that, I don't believe, with unpaid internships. Of what the type of internship I'm talking about, where it's more of a professional like work setting where people are producing work. So, I won't spend a lot of time on the social determinants of health framework, but I do want to bring it up. The conditions in which people live, learn, work, play, worship, and age that impacts the quality of life outcomes and risks. So that's over here to the right-hand side here, circled in purple. And those are shaped by the distribution of money, power, and resources. So we've already talked about money with regard to pay, and we've talked about power and whether or not interns can demand that they be paid for their labor. And that does impact the way that they can pursue education, what kind of occupation they can have, what kind of income they can have, not just during the internship, but how are we setting them up for success in their career or not, and making sure that everybody has an opportunity for success. And, I think we're then intervening in the way that we value or don't value people here in the left-hand box of the context. And again, my vision is that we eliminate unpaid internships certainly in the health sector, but across our entire economy, that it's not an equitable way of treating people at the very start of their career, especially if they're producing work for an organization. And I want to talk a little bit about what's happening in our economy. So inequality has been rising for decades. This is the Gini coefficient, it's been rising. On the Gini coefficient, a 1 measure, which we're still under 0.5, but a measure of 1 would be one person getting all of the income. So we've gotten closer toward that. A 0 score would be everybody earning the same income. So you can see we've become less equal in terms of income. You can see the median wages, a stark inequity between people of color and white people. So structural racism certainly at play here, and class inequity as well. As you can see that that the median wages drop for white folks as well. So both racism and class inequity at play here. And if we had a chart that showed this broken down by gender, we would also see that women of color are paid less than men of color and are the lowest paid among these groups, and that has to do with sexism. So these systems are compounding here, and we can see how that plays as well, and internships is but one part of that. We see a rising cost of education. So the number there for 1985-86 has been adjusted for inflation. You can see a near doubling from 85-86 to 2017-18. And again, internships is but one part of this. It's not obviously the main part of that, but it is a piece of it. But that's the context in which many interns are existing, is that kind of paying for like a very expensive degree. And that impacts the amount of debt that they take on, which is also linked to structural racism and certainly class inequity. And I'm not going to go through this entire chart, but you can see that those who currently owe education debt, people of color, Black and Hispanic represented here, are far more likely to owe education debt and be behind on payments than are white people. And that has everything to do with the way our economy is set up to be unfair. So why focus on internships? Why? If I haven't convinced you yet, I think this to me depicts it, right? So that's not an internship, that's a rocket ship blasting off. And I think that the internship is, it's kind of like the launch pad of careers. It's the point at which it's often the very first time that somebody has kind of a formal relationship with a career of choice, or with what Yazmin was talking about was, kind of exploring career opportunities. But for the internships I'm talking about at Health and Medicine, this is, they're in a degree program pursuing a health degree. And so if we're setting them up to succeed, but if people don't know that there is a launch pad or where to find that launch pad, or they can't get to it, then I think we're not doing everything we can to help ensure success. This is a model developed by the Chicago Area Health Education Center that's located at Health and Medicine Policy Research Group. They developed this a few years back. We see internships here as part of training and education, and that internships should be a part of the launch of a health career with good pay. So those two, the second and third arrows in that trajectory. And so internships are just one part of that. It's not everything, but we see it as an essential part of both the education and pursuing a successful career. So this is our vision. I'm not going to read it to you, but basically that we want this to be an excellent opportunity that advances equity, diversity, and inclusion, and that we model that for the sector and for our economy, and that we pursue this more broadly, right? Because we're a policy organization, we're not happy to just change ourselves, as important as that is, but to try to improve policies and systems and structures to be more fair. So as I mentioned, usually we have graduate students, sometimes undergrads, usually 15 to 20 hours a week, and different projects working on policy and programming of health and medicine. I don't have time to go into the details of the types of projects those are, but would be glad to talk about those during Q&A. This took us time to work through this because as early, several years ago, going further back than this was depicted here on this slide, staff were raising this issue around pay and why aren't we paying our interns, and shouldn't we be? And so it took time to kind of work through that and to discuss, okay, how do we go from the model where, if you need an intern, you go to this repository of applicants and you say, okay, we'd like an intern to work with us on this project, and to something that's more programmatic and really well detailed and is paid and is equitably offered as an opportunity. So that's, again, I'm not going to read through it. You can see that it has taken time. I do want to mention we just finished our first cohort, which was also virtual. We had 39 applicants. We used to get a lot fewer applicants than that with our passive model. And I think part of that is pay, and certainly it was a truncated application period. We just finished and we're working through our applications for the beginning of next year. We had 142 applications. So you can see that the proactive promotion and I think the aspect of pay both led to that. Of course, that creates some work on our end to work through those, and really curious about can we offer more internship positions? So this is a list of the things that we work through as a committee: our outreach, our review process, onboarding and orientation, which before it had been more individual, so your preceptor would onboard you, but now it's much more group, and we want to form more of a cohort model such that our interns get to know each other and form relationships. We work through our offboarding process, our post-internship relationships. So how do we relate to interns after they're finished with us at Health and Medicine? The single door application, I think, is essential for this kind of program, because otherwise people will email, the executive director, or they might they might know me, they might know another staff member. So we eliminated that. There's one application for each. We want to do a spring, summer, and fall internship cohort. So kind of, if somebody reaches out, we just say, well, there'll be another cohort in a few months and you can apply for that. Again, onboarding, better integration of interns into our work, attendance at staff meetings instead of before they weren't. So a lot better integration, and really trying to form relationships with staff, with board members at Health and Medicine. Certainly the paid aspect, as I mentioned, is really important. And then I want to jump back down to that last one, 2 preceptors, because, I might have a busy week, or I might be off for a week or a half a week. And to have 2 preceptors means that an intern can go to their other preceptor if a staff member is unavailable for them. either to check in on a project or to be assigned something if they've completed a project. A few lessons, and then I'm going to try and close. So change can come slowly. I'd say you have to build a collective understanding of the problem and discuss it with people, talk about it. That's where to start is a conversation. There's likely money to be found in your budget. This doesn't cost that much in terms of pay, which I think was the first hang up for folks internally. I think we have to be firm about the need for change and talk about our values for equity and for ethics, to develop a path for change. And really, so that's where our committee came in. I'm not going to go through all of these, but again, I think we have to talk about pay. We really do need to talk about that, because that is, at least in a capitalist society, that's how we value people's work. People can't pay their bills with experience. And if they're in a position where they need to work to get through school, we don't want to set people up for failure in all of that. So we really have to be thoughtful about it. And I think depending upon who you are and what kind of organization you're at, you might have different roles here. So universities, I would say, need to break the cycle of indebtedness. That universities do play a broker role, I would say, where they're brokering the labor of students who have picked up significant skills during their studies, and brokering that labor to nonprofits who definitely need labor, because there's an unending amount of work to be done in the nonprofit sector. Nonprofits, I think, need to stop going along with that, and that so that's something that we need to work on. Funders need to support paid internships, both with money, but also to set it up as an expectation of grantees, as a mark of their commitment to equity and inclusion. Interns and students can organize with each other, and then policy change is needed on this front. And there is a national group called Pay Our Interns that you can also connect with. And I think this is a really important question, is how can we leverage our sector to get equity, to advance equity? Because the health sector is the biggest sector in Illinois' economy. I think we sometimes forget that when we talk about social determinants of health, as if it's like outside the sector and somewhere else, but these are jobs, and it's not just during the internship, it's kind of the career trajectory, and what kind of trajectory are we trying to set, and is it equitably accessible such that everybody is able to succeed in their careers. I want to thank my committee members, some of whom I still get to work with, and others who have left health and medicine over the course of our work on this. It certainly was a team effort. And just want to raise up here at the end that it takes power building. It takes really making a demand to change things in society. It doesn't just happen. So that takes organizing. And this quote from Frederick Douglass, I think, is appropriate for that. And with that, I'll close and look forward to our conversation. Thanks so much.
Excellent. Thank you, Wesley. We are going to open for the rest. We have 12 minutes for some Q&A. I'm going to monitor the chat, so in case someone wants to post there. Otherwise, if you want to unmute yourself and ask a question, go right ahead. Okay. I don't see any questions being posted. So if you do have one, please post it. Otherwise, I want to thank both of the presenters for an outstanding job on their presentations. And we can, just to let you know that the next session we're going into is breakout session 4. And that's the last breakout session for the conference. So if you're interested in track 1, which is this breakout session 4, we have 3 oral presentations on COVID-19 coming up. Excellent. Well, thank you both for your presentation. And I hope you look forward to the rest of the conference, especially our keynote presentation at the end by Kim Wasserman. Thank you.
Thanks so much. Bye-bye.
Yeah, thank you. Goodbye.